very much, Eray, for the nice presentation. I would like to thank Eray again for inviting me to this scientific organization, and I am very happy to be with you, with young scientists. Now I'm going to talk about preparing a case report. You see two journals. The first one is Turkish German Gynecological Association. I worked with Eray for many years for this journal. Now I am one of the two editors of the journal. It's indexed in PubMed and is also present in Web of Science. And the second one is the Journal of Gynecology, Obstetrics and Neonatology. For about 4 years I was the editor, and now I'm the chief editor and owner of this journal. This is the official publication of our hospital. Our hospital's name is Zekai Tahir Burak Training and Research Hospital, and in the future I'll be very happy to work with you if you choose to be an OB/GYN. I'll be happy to work with you. And I am waiting for your submissions to these journals. Yes, my topic is preparing a case report, and in the light of my experience in the two journals, I'll try to give you some tips. You know, the case is a really real-life situation, and the case report is the analysis of this situation. You know, when we look at the hierarchy of the reliable scientific information, randomized clinical trials are at the top and case reports are at the bottom. So why do we write a case report? Because case reports provide new knowledge to the literature and readers find them interesting and educative. I got over 90 manuscripts, and only one of them is a case report, and the first one is the case report, and I never write again a case report. All of them are clinical trials or reviews. So it's a very good start to begin with writing a case report. What is the study design of the case report? The retrospective design is the most commonly published form. It's the simplest form to write and an excellent design for the beginner. The prospective design is suitable for case series. When to write a case report? What are the reasons for writing a case report? You see a lot of reasons. One of them is to report an unusual, rare or unknown disorder. When we look at the examples, you see Merkel cell carcinoma usually occurs in black women. Usually occurs in white men, sorry, here you see, usually occurs in white men, and the authors reported a Merkel cell carcinoma in a black woman. So this is an unusual disorder, so it's worth publishing. When you look at to describe unusual or puzzling clinical features, it's worth publishing. You see the title, Pyramidal Signs in a Caucasian Patient with Spinal Muscular Atrophy, a case report. Generally, the clinical symptoms of SMA are progressive muscle weakness. Here you see, in this patient, another type of symptom, it's asymmetric onset of weakness. So, if you see unusual or puzzling clinical features, it's worth publishing. When you describe a rare or new adverse events, it's worth publishing too. You see, the disulfiram-induced psychosis. You know, disulfiram is the commonly prescribed drug for the treatment of alcohol dependence, and if it causes psychosis, it's a rare adverse effect, so you can publish this. When you are writing a case report, you should obtain consent from the patient to publish, or you should obtain approval from your institutional review board. Some of the journals want also the sign of the patient, so don't forget to obtain these consents. What's the length of the case report? Case reports should be brief. 500 or 2,000 words are recommended, so length should not exceed these limits. You see, the Lancet is a very high index journal. You see, they prefer in case reports to use no more than 450 words. So you should look and learn the style of the journal before starting to write a case report. Here you see the components of the case report, the title of the case report, the abstract of the case report, the introduction or background of the case report. Here you see the discussion part, the conclusion part, the acknowledgements, and references. Also, you can add figures or tables to the case report. When we look at the title should be informative, accurate, concise, effective, and the title should facilitate retrieval with electronic researching. You see some examples of the titles. Brain-hydrated kids with atypical symptoms in an adult, a case report. An unusual presentation of a stroke in a developing country, a case report. Preoperative embolization and immediate removal of a giant pituitary adenoma, a case report. Brain tumor of the testes, a case report, and review of the literature. According to GENIEC, 4 elements should be present for the informative title. What are them? Let's look at an example. The title of the case report is Changes in Isometric Low Back Extension Endurance Times After an Endurance Training Regimen in an Office Worker with Low Back Pain. You see, intervention should be named in the title. What's the intervention here? Endurance Training Regimen. Outcome of the intervention should be identified. What is the outcome? Change in isometric flow, back extension, endurance time, and population under the study should be identified. What is it? Office worker, and the condition of interest is stated. What is here? Is low back pain. So you should be careful to include all 4 elements in the title. When we look at the abstract, it's usually required, we talked about it, usually required by most journals when submitting case for publication, you know, and it's a consent version with word limit. It's important as indexed by most electronic databases, as it is required by most scientific meetings when submitting a case for presentation and used by reviewers and judges to determine merit. Here's an example from New England Journal of Medicine. They want brief reports to begin with a brief summary of no more than 100 words. So please look at all journal sites when you write a case report to know exactly the number of word limits. When we look at the introduction and background part of the case report, it should it should be the overview of the larger problem. We should put 1 sentence description of the patient, and we should point out why this case is unique. Is it previously unreported? Is it a new pattern? Previously unsuspected relationship, unusual diagnosis, prognosis, therapy, harm? And does it contribute to scientific knowledge? What are the learning points? You should give all in introduction or background. When we look at an example, the title, Congenital Diaphragmatic Hernia Presenting in a 7-day-old Infant. You see, congenital diaphragmatic hernia is described here, is a rare condition. Its incidence is given here. is an overview of the problem. You should put at the beginning of your introduction part, background part. And you should also add, why is this case unique? You see, rarely patients develop herniation through a diaphragmatic defect beyond immediate newborn period. In these cases, the diagnosis of congenital diaphragmatic hernia may be unsuspected. So you should give here why this case is unique. And you should also put in the background section with a one sentence the description of the case. Here you see, this case illustrates one such example and reminds providers to stay vigilant in the diagnosis of late presenting congenital diaphragmatic hernia. When you are writing the case report part or case presentation, you should give the detailed description of the case, the chief complaint of the case, the history of the present illness, the physical examination of the case, the diagnostic studies, the treatments, the outcomes, and the case should usually need proof of the diagnosis beyond a doubt. Let's look at an example. Here you see the same case report. A 7-day-old male presented to the emergency room after respiratory distress was noted at an outpatient well-child clinic check. Here you see the chief complaint of the case. Here you see on history, the parent reported increased work of breathing starting the previous day, the history of the illness. Here you see the physical examination of the case. On exam, the infant was in respiratory distress with a respiratory rate of 70 breaths per minute, heart rate of 161 beats per minute, blood pressure of ... and a health had a pulse oximetry reading of 91% on room air. He was noted to have subcostal and intercostal retractions, cyanotic extremities, so on. You see the physical examination of the case, and you see the diagnostic studies. In the emergency room, an arterial blood gas was drawn with pH, PCO2, PO2, and base excess. CBC showed white blood cell count, hematocrit. Also, when you are using the abbreviations, please give them detail when you first use. This is another important point when you're writing a manuscript. And here you see the other results of the diagnostic studies. And in the case presentation part, you also see the treatment of the case. Herniated transverse colon and small bubble were reduced, and the defect was primarily closed. After physical examination, laboratory results, you also mention the treatment of the case. And also, the outcome of the case should be added. You see here, the infant had a benign hospital course, and on the day of 13, he was charged home. After surgery, the infant had no further respiratory or gastrointestinal complications. And you should also give the outcome of the case. In discussion section, Yiğit touched every point of the discussion section. It's the most important section. You should give the literature review with recent references. How is this case different or unique? You should emphasize this point, it's very important. You should also give the learning points of the case, and alternative explanations and new hypotheses should be also added at discussion part. When you are writing the conclusion part, and you should add also a conclusion part in your case report, it must be the last paragraph of discussion. You should put take-home messages there, and you should also add recommendations to clinicians and scientists, and future implications should also be added here. For references, you should check journals' instructions for authors. It's an important part also for me. As an editor, I'm also looking at the reference section. It's the part that you give your seriously to. You should give serious importance to this part. More is not always better. Remember space limitations. Case reports also have reference limitations depending on the journal styles. So look at the journal styles, how many references you can put in the reference section for the case report. Please learn and then begin to add references. And avoid abstracts as references and personal communications as reference. Don't put personal communications as references in case presentations. I would like to thank, this is the end. Thank you.
We conducted a research committee in our faculty as a committee of usual education. Now some of our students will write case reports, posters, and they receive data from their mentors. All the students almost have mentors here in this faculty. So I think they will benefit a lot from today's talkings because they had to finish it by Wednesday. In its last form. I think there is a question. Yes, sir. Yes, please.
Why don't you send it to a journal? He will check, and if it's okay, you will sign. Then you can use a general style. You can start with the author's name, with surnames of the authors and the initials of the authors. Then please give attention to the dots. You'll use semicolon or colon according to the style of the journal, but if you don't start at the beginning, you can put comma. And then at the end of the author's name, put the title of the article and then the journal abbreviation. Look at PubMed for the official abbreviation of the journal's name. And then give the year of the article, the volume number, and the pages of the manuscript. Okay. Yes. Unusual. Yes, yes. Shh. How about its rarity? Is it the 10th case? Is the first case, the second case? You know? Third case. Then you can use the number.
I'm using the microphone.
Where did you put it? Of course. If you want one by one, if you give no personalized information in your abstract, you can take, it's not necessary to take consent, but if you give personalized information, when I read the case, if I see something that I can know the patient, you should take consent. Second one.
retrospective after that. So, and some ethical communities must require a consent from the subject of the study, no matter what kind of study it is.
Sure.
In case of case reports, is it similar?
It's not similar because if in your case report you give personal information, and if it is understandable from the case report, you should take consent. If you use a picture of the patient, you should take consent. It's not important if it's retrospective or not. But if it's a clinical study and if it's retrospective, you shouldn't take ethical approval. But be sure that most of the journals, even if your clinical trial is retrospective or prospective, they all want ethical committee approval.
I want to add something to that. If you are giving the picture of an anomalous fetus, whatever you do, you can cover the eyes, but you should take consent of the family and also ethical approval for that. But if not, I mean, things happened, everything changed, so you are paresthetic, it's not applicable. It's not needed most of the time if you are doing retrospective. But in order to make a good case report, don't report it after everything has happened. If you see something rare, check the literature at that time. For example, I have seen a case of pregnancy in a non-communicating uterine horn. I understood it's not communicating after we operated. But when I saw that, I just checked the literature and thought, what can I put on this literature? So we did MRI angiography to see where the blood supply is. Also we did 3 Tesla MRI. We are sure it will not leave, so we can do MRI, contrast, whatever. And at that time we could predict that it will rupture, from which point it will rupture also. So this is, do the case report. When you see the case report, check the literature, think on it, think what you can change about treatment, diagnosis of this case report, and then apply it and then report it. Okay? Or just saying, yes, I had a rudimentary horn pregnancy. So what? It was described before. But now I'm saying something else. I have applied a new technology to describe that it will rupture within a day, within 2 days, because it is having its blood supply from there, it is invading the uterine horn, things like that. Okay. Do the case report, plan it as immediate as you see it, so that you can put something on the literature. Yes.
Thank you very much for your nice presentation. In Balkan Medical Journal, we asked for the authors about informed consent for all case reports. I think it's an important issue. And second one, you can find a checklist just like the other manuscripts, for example, cohort studies or randomized controlled studies. You can find a checklist in Equator Network System. The name of it is CARE. If the student visit the website, over there they can find a checklist to find their way.
Our Turkish journal, Association Journal, does not accept case reports, unfortunately, for about 1 year. But you can send your case reports to my journal. Thank you.